Hello and welcome to this overview regarding the revised UK Foundation Programme Curriculum. This summary is designed for trainers and supervisors. In this presentation, the key updates and what they mean for supporting foundation doctors in practice will be covered. My name is Paul Clark. Angela Burton and I have jointly prepared this presentation and I'll be taking you through it today. We're Foundation Programme Directors for Portfolio and Generic Skills with the Northern Foundation School and co-chairs of the UK ePortfolio Team Advisory Group. We work closely with the UKFPO to share good practice in the delivery of the UK Foundation Programme Curriculum and especially through the Foundation ePortfolio. In 2026, the Foundation Programme Curriculum, originally introduced in 2021, was carefully revised following extensive stakeholder consultation during 2025. This brought together input from the Academy of Medical Royal Colleges, Foundation Programme Committee, Foundation School Directors and Training Programme Directors, as well as Foundation Doctors through the Advisory Board. Patient representatives, NHS employers and Royal College experts also contributed, alongside organisations such as the Royal College of Paediatrics and Child Health, Sustainability and Quality Improvement and National Patient Safety Leads. The revised curriculum reinforces the Foundation Programme as a generalist training pathway with a strong emphasis on patient safety, care for people of all ages, including children and young people, sustainability and quality improvement, and a core teaching programme addressing health inequalities and multimorbidity. While the curriculum has been updated, there are no changes to the overall assessment framework. High-level outcomes and foundation professional capabilities remain in place, with some wording updates to reflect the revisions. Supervised learning events continue to be key, with greater emphasis on demonstrating patient safety. Quality improvement activity also remains central, with encouragement to consider sustainability. Supervisor reports and multi-source feedback, including TAB and PSG, continue to support assessment. Importantly, the summary narrative should now clearly reference patient safety and highlight any work that promotes safer clinical practice. The revised curriculum also introduces some changes in terminology. The term trainee has been replaced with resident doctor, foundation doctor, or FD. The phrase differential attainment has been reframed as fairer training cultures, emphasising a more inclusive approach. Teaching content has also expanded, covering areas such as mental health, health inequalities and social justice, alongside multimorbidity, frailty and end-of-life care. There is increased focus on human factors and systems working to promote patient safety, as well as leadership, safeguarding, digital healthcare and quality improvement with environmental sustainability in mind. The curriculum highlights how patient safety can be evidenced through the ePortfolio. For Foundation Professional Capabilities 1 to 5, there should be clear evidence of safe clinical practice. This includes safe and high-risk prescribing, blood transfusion, and effective use of guidelines. It also includes effective handover, documentation, and team working. Evidence can be captured through supervised learning events, multi-source feedback such as TAB and PSG, and reflective practice, helping to build a comprehensive picture of safe, day-to-day clinical work. For Foundation Professional Capabilities 6 to 9, the focus on patient safety continues. This includes the importance of handover, along with communication, availability and team working, particularly when recognising and supporting care of children and young people. Evidence can be gathered through multiple tools, including SLEs, leader forms, supervisor reports and multi-source feedback. Quality improvement activity remains essential, with an emphasis on sustainability and initiatives that enhance patient safety. In addition, Foundation Professional Capability 13 focuses on exploring the breadth of medical practice supporting broader knowledge and career development. So what do trainers and supervisors need to do differently? The key message is that the tools you already use, such as SLEs, tabs, PSG feedback and supervisor reports, remain unchanged. However, it's important to use these tools to emphasise the updated focus on the curriculum, encourage foundation doctors to engage with the revised curriculum and behaviours within the foundation professional capabilities. When giving feedback, clearly highlight where practice demonstrates patient safety, including recognising risk, learning from incidents and contributing to safer systems of care. Also emphasise inclusive care, particularly for children and young people, and encourage reflection on environmental sustainability, especially within quality improvement work. Finally, ensure foundation doctors are engaging with the updated core teaching programme, including learning about health inequalities and multimorbidity. To summarise, foundation doctors should complete a range of supervised learning events during each placement, ensuring there is sufficient evidence across the year to demonstrate achievement of the curriculum outcomes. These revisions reflect a progressive curriculum that promotes patient safety, inclusivity and sustainable health care, aligned with modern clinical practice. Patient safety is central, and updated language ensures greater inclusivity for children and young people, recognising that foundation doctors frequently interact with this group across a range of settings. There is also clear emphasis on environmental responsibility, encouraging foundation doctors to consider the impact of climate change and demonstrate learning in sustainable healthcare practices. Together, these updates support a more inclusive, forward-looking foundation programme, bringing key aspects of the curriculum up to date with developments over the past 5 years. Thank you very much for your time and for all your ongoing support as trainers and supervisors of foundation doctors.